Hello friends, today I bring to you a few clinical problem solving questions on psychiatry. You can score full marks in your NEET PG or Next from questions in psychiatry. So take notes, listen carefully and watch the video again and again so that you get a good grasp on these questions which will be helpful in your NEET PG or the national exit test. Number 1. A 24-year-old man is afraid of flying and he presents at the request of his work supervisor. The patient describes how he has been driving to all his appointments even when he has to drive several states away. Which of the following is the most likely diagnosis? The 24-year-old man is afraid of flying. So he drives all the time because he is afraid of flying. So what is the most likely diagnosis? Let us look at the options. A. Social phobia. B. Specific phobia. C. Generalized anxiety disorder. D. Delusion disorder. What do you think is the correct answer? A. Social phobia. B. Specific phobia. C. Generalized anxiety disorder. And D. Delusional disorder. So let us look what is the correct option. The correct option here is B. Specific phobia. The phobia is fear of flying. This fear of flying is called as aviophobia, and this aviophobia is a specific phobia. You recommend high dose sertraline for a man to prevent future episodes of indecent exposure. The person is exposing indecently. So you recommend a high dose of sertraline. Therapeutic effect is most likely to occur due to activity at which serotonin receptor. So here we must know which serotonin receptor on which this therapeutic effect of sertraline occurs. Let us look at the options. A 1A, B 1D, C 2A, D 3. Now sertraline is an antidepressant. So all the antidepressants that inhibit the serotonin reuptake can cause sexual side effects. What are the sexual side effects? They are decreased libido, delayed or absent orgasm, and these effects are thought to be mediated by 5-HT2A. 5-HT2A. Now, where these SSRIs are used, selective serotonin reuptake inhibitors, they are used to treat paraphilias as well as hypersexuality in neurocognitive disorders. So the correct option here is 2A receptor. So it is C. So let us look what is the correct option. The correct option is C, that is 2A. Let us move on to the next question. Which eating disorder may be complicated by Bezoar? Bezoar. What do you mean by Bezoar? Find out. Toxoplasmosis. Intestinal perforation or lead intoxication. You must have heard about trichobezoar. Tricho means hair, bezoar. So hair in the stomach. Why? The patient is eating a lot of hair. So let us look at the options. A. trichotillomania, B. binge eating disorder, C. pica, and D. rumination disorder. A. trichotillomania. You must have heard about trichotillomania, plucking of hair. Then binge eating disorder. Binge eating disorder is a very important topic. And pica means eating the things which are not required for eating. So what is pica? Pica involves the eating of non-nutritive, non-food substances, and it may be complicated by Bezoar. What is Bezoar? A concretion forming in stomach. And what is trichobezoar? Trichobezoar is hair balls. Now, toxoplasmosis can occur if the person eats feces or dirt. And why does perforation occur? Intestinal perforation can occur if the person eats some sharp or hard object. And lead intoxication occurs due to eating lead paint chips. Now what is binge eating disorder? Find it out and comment in the comment box. So if you want to such videos or want more MCQs or more guidance, you can click the link in the description box. Click the link in the description box and join the WhatsApp group. You will be getting different types of PDFs, sometimes free masterclass. So whatever help you require, you can ask in the comment box. I will be happy to reply to you. So let us look what is the options here. What is the correct option here? We already know it is pica. That is, the option is C, pica. Which of the following personality disorder is most prevalent among relatives of patient diagnosed with schizophrenia? A. Schizoid personality disorder, B. Schizotypal personality disorder, C. Paranoid personality disorder, and D. Narcissistic personality disorder. So what do you think is the correct option here? Now, schizotypal personality disorder. Schizotypal personality disorder is characterized by odd and peculiar thinking and behavior, and it is more common among first degree relative of patients with schizophrenia. So the correct option here appears to be B, schizotypal personality disorder. Let us look what is the correct option. The correct option here is B, schizotypal personality disorder. You can click the link in the description box. If you have any doubts, you can ask in the comment section. I will be happy to reply to you. You please like, share and subscribe and tell your friends about this video. It will be helpful to score full marks. I will be making more such videos. Thank you.